I think communication skills are the biggest barrier for this, to be honest. And I think communication skills have become a much bigger agenda on medical students and registrar level doctors, but it's still not enough when you're talking about such a taboo subject as death and dying. And I would like to see compulsory, I shouldn't maybe use that word, but certainly highly recommended that all doctors undergo an annual update on their communication skills with regard to advanced care planning and death and dying. I think maybe it's because we don't do enough of it at the moment to become slick at it and skilled at it and fluent at it. And it's a little bit like doing your CPR updates. Most of us GPs virtually never use it, but we have to keep up to date. It's considered essential. But there's such a low success rate from CPR, and there's such a huge wealth of return from doing an advanced care plan. I kind of feel we're almost missing the bigger picture here. This can be tricky. Sometimes they're less wanting to talk about these issues than actually the key patient themselves. My latest trick in this book is to suggest that they listen to the most wonderful physician, Atul Gawande, who gave the Wreath lectures in 2014 for the BBC. And in lecture 3, he goes through the advantages of making advanced care plans and how important they can be both to the patient and the carers. It can be obtained on the BBC Radio 4 website or on BBC iPlayer, and I would strongly recommend anybody that is unsure about advanced care plans to have a listen to Atul Gawande talking about this issue.